Good morning, Mrs. Whitten. My name is Dr. Newton and I am the residential care physician responsible for your care while you are living with us at the Happy Valley Care Home. I am glad that you could join us this morning for your care review. I see that your daughter, Mrs. Wilkshire, has been able to join you. Today we are going to be chatting with you both about your care, so I have asked Andrew Chan, our pharmacist, and Satinder Gill, your primary nurse, to participate. How are you feeling these days?
Well, to be honest, not so good. So sleepy, drowsy, clumsy, angry.
I'll second that. She has been complaining of nausea and has not participated in any of the activities that she normally does. I have to practically drag her out of her room when I come to visit.
And don't forget the fall last week. We were really worried about you fracturing your hip. That was a close one.
That is why I am now in the wheelchair, to unsteady on my feet. I get woozy. Dr. Newton, is there some kind of medication that you can give me to make this go away?
Well, now that you mention it, this is something I would like to discuss. I think that the symptoms that you are displaying and feeling are a result of polypharmacy.
Polypharmacy? What is that?
Polypharmacy is best described as the situation where a person is receiving medications that may no longer be beneficial to them. Medications have many side effects, and as we age our bodies change and no longer absorb or metabolize them like we used to. This can contribute to the unwell feeling that you have described. Having too many medications can also lead to confusion and decreased cognitive ability, and in some cases creates, especially in frail seniors like yourself, unsteadiness can lead to increased falls, like the one you had last week.
Here is an interesting statistic. Did you know that 50% of our seniors living in British Columbia experience polypharmacy by receiving one or more unnecessary medications per day?
And with seniors living in residential care receiving an average of 9 medications every day.
There has been a concerted effort by doctors and the Ministry of Health to reduce these numbers significantly. This is known in BC as the Shared Care Committee Polypharmacy Risk Reduction Initiative, and one component of this initiative is dedicated to reducing polypharmacy in the residential care sector.
So how does this polypharmacy work? What does it entail?
How does polypharmacy happen? Sometimes when seniors become ill, they will need to visit a clinic versus going to their own family doctor. These doctors are trying to help you by treating whatever symptom or issue you might have, but it can be difficult because they don't have your full medical picture. They will make a best guess about what you need.
Drat, the only reason I went to the clinics is because my family doctor moved offices and left me high and dry.
That is an unfortunate situation, and I am sad to say, orphaned patients are quite common in our current healthcare climate. I am sorry that happened to you. It is exactly these things that attribute to you receiving medications that may have been useful at one time, but as the months and years roll along become harmful versus helpful. But we will make things right. As the residential care physician, I will be reviewing your medications with Andrew and Satinder on a frequent basis, at minimum twice yearly, to ensure that you are receiving the right medications and only the right medications. As part of your consistent care team, we will make a plan with you to address your polypharmacy reduction. However, a very important part of this process requires you and your loved one's participation. We all need to be in this together if we are going to be successful. Does that sound like a good idea?
Yes, okay. So how do we do this?
Do you just cut her off all of her meds?
Oh goodness no. The process starts with the meaningful medication review. This is what we are here to discuss today. By using a standardized and consistent approach, we can ensure that we are thorough in our assessment of your pharmaceutical needs.
Typically we ask 9 questions while performing the review.
Is each medication necessary? Is the drug contradicted in the elderly? Are there duplicate medications? Is the patient taking the lowest effective dosage? Is the medication intended to treat the side effects of another medication? Can the drug regime be simplified? Are there potential drug interactions? Is the patient adherent? Is the patient taking an over-the-counter med, a herbal product or another person's medication?
And based on the answers we receive, the team builds a care plan around eliminating some of the medications. Careful dose changes, observations and documentation and input from you will ensure that we remove the medications in the most safe way possible. It is important for us to plan around your safety when reducing your medications, being available to assist you with changes, and carefully monitoring and supporting activities that you would like to do,
so she can participate in more of the activities here in the home again, and perhaps get back to walking?
What if I have a reaction and need to go back on the medications?
It is important that you tell us how you feel. It is also important that you let your nurses know too, so that they can document any changes, side effects, concerns. If we need to reintroduce a medication, then we can do so, but with much more scrutiny than before.
How will we know that our efforts are successful?
Good question. Currently there is not a great deal of information out there about post-polypharmacy reduction initiatives, but as we go through this experience together, we will collect data on a resident-specific basis, including how your mom is feeling, how her memory and cognitive status are, whether we are seeing an increase or decrease in falls, all sorts of things to help us monitor how this is going for her.
Okay, let us do this. I am tired of feeling awful. I promise to keep you in the loop on how and what I am feeling.
And I will let you know right away if I notice any changes.
Great, let's get started. Satinder, please lead us off with reviewing Mrs. Whitten's medication administration record.